through the curricular renewal, we'll be able to, I think as trainees, remember that there are multiple facets to training that are required to become a solid fellow at the end of training. Clinical skills are often prioritised, and sometimes at the detriment of other really important skills like communication skills, team building, management, bigger picture skills. So I think some of those non-clinical but very core skills will be able to be emphasised given the appropriate time.
So look, in general internal medicine, and cardiology is one of those specialties, everyone needs to be able to evaluate a patient, engage with them sympathetically, diagnose their priorities and come up with an effective management plan. Everyone needs to be able to adjust and modify that management plan based on outcomes and know how to seek further advice and when to seek additional help and technology. The ability to know the limits of your own knowledge is a very important skill, but understanding what is out there so you know that there are opportunities not lost for individual patients are general to all branches of internal medicine.
So I think there's a whole range of, I suppose, more termed soft skills around leadership, ethics, communication and professionalism, which are absolutely key, both to our specialty and a whole range of others.
I think all trainees and physicians need to be excellent communicators with both their patients, their medical teams, allied health staff, parents if necessary for paediatricians. So that's a core skill. I think they all have to have a standard of ethical behaviour and professionalism in the workplace.
Professionalism, which includes things like communication, leadership. Communication is a very broad term, but I'm not just referring to communication with patients and in my case parents, but also communication with other professionals, particularly in community child health. Communication with allied health professionals is very important, and often that happens in the context of clinics that are not hospital based. They're based in communities, and that means that the status of the paediatrician in that locality might not be the same as it would be if that person was working in a hospital.